Amen.
Good afternoon, everyone. Bonsoir, hola, bonne tarde. My name is Tony Branch. I am the Executive Director of Haitian Community Partners here in the great city of Brockton, where champions are born and cultural diversity is celebrated. We are delighted to be here today with local leaders, Mayor Robert Sullivan, State Representative Jerry Cassidy. I understand that Senator Mike Brady has a committee. We are also thrilled to be partnering with the Healy Driscoll administration, MassHealth, the Health Connector, and Healthcare for All in this critically important campaign aimed at reaching MassHealth members to keep their health care coverage up to date. Thank you to the Cape Verdean Association and the Brockton Worker Alliance in partnering with us in this campaign. Excuse me. And a special acknowledgement to Marlene Amity, our board president and founder of Haitian Community Partners. Haitian Community Partners' mission is to work collaboratively with community-based organizations to improve access to the underprivileged in the areas of social services, immigration, youth leadership, and healthcare services that are appropriate, comprehensive, and culturally sensitive. MassHealth is a lifeline for thousands of people in the Brockton area and across our Commonwealth, a lifeline that is essential to accessing Massachusetts' high-quality healthcare and coverage, access that was crucial during the COVID-19 pandemic. However, the public health emergency, the public health protections has ended. MassHealth members were covered during that pandemic, so we now are here today in terms of setting out to continue our campaign. In collaboration with Healthcare for All and our partners, Haitian Community Partners is working to make sure MassHealth members living in our community understand that they need to act now and stay covered. This is critically important because many members have never gone through the MassHealth eligibility redetermination process, and for others, it has been nearly 3 years. Our staff and volunteers are out in the community at local events like our wellness event in August, our tabling at the Westgate Mall, and our distribution of multi-language leaflets at city events, and most importantly, our Brockton One programming on public access and Haitian radio. All of us at Haitian Community Partners are excited to be a part of this important effort to spread the word in Brockton, and we cannot emphasize it enough. If you are a Massachusetts Health member, you need to, repeat after me, act now and stay covered. Please go to masshealthrenew.org for more information and to get your help. With that said, I would like to introduce Elizabeth Denison, Chief of Staff and Senior Advisor at MassHealth. Thank you, merci, obrigado, and gracias.
Thank you so much, Tony. Hard act to follow. But good afternoon, everybody. It is a pleasure to be with you here in Brockton today. I feel privileged to be here on behalf of MassHealth as the Chief of Staff. As all of you know, MassHealth is required to renew coverage for all of our members this year, a process that began in April. So over the next 7 months, MassHealth will continue its efforts to review the eligibility of every one of our 2.4 million members. Maintaining coverage is our North Star. We want to keep everyone who's eligible for the program on MassHealth and provide affordable coverage for those who no longer qualify. So for MassHealth members, this means act now so you can stay covered. I just want to say, if you get a blue envelope, open it, read it, and respond, or any other mail from MassHealth. I think some people think, hey, I may not be eligible anymore, but a person in your household, a child may be. Respond. And if you have questions or are having any trouble, we know it's complicated. MassHealth applications are not always the easiest to navigate. Call us. 1-800-841-2900. We're staffed up and we're really ready to help. So we at MassHealth are so proud to be partnered with the Connector and Healthcare for All in this effort. What amazing partners. The Connector is a leader in the nation at getting those who are no longer eligible for MassHealth to enroll in their subsidized plans. And we're making that process seamless. And then HCFA, and together with all of their canvassers, who I just am really so happy to much for the work, knocking on doors. They have knocked on nearly 370,000 doors. And people are answering those knocks. It's really amazing. That's not easy. You were saying before, like, you have to be friendly and persistent. And the community-based organizations, like the ones here, have held 1,100 events in people's communities and near their homes to get MassHealth members to engage and apply. So I'm really just here to express MassHealth thanks for the commitment and dedication of all of our partners. And it is a pleasure to introduce Audrey Gasteyer, the Executive Director of the Health Connector. Thank you.
Good afternoon, everyone. It is such a pleasure to be here in Brockton. Thank you so much. Thank you to Haitian community partners, all of the community partners, the canvassers who've been doing the ground game here in Brockton. Thank you to Mayor Sullivan, Rep. Cassidy, and everybody who's here to join us today. We are now nearly 6 months, almost halfway, into what is really a monumental effort that relies on the entire full spectrum of our healthcare landscape here in Massachusetts and all of our communities to ensure that everybody in Massachusetts continues to have health coverage. It's such a privilege to be here today, not only with our partners from MassHealth and Healthcare for All, but all of the partners in the room who've committed to this work and making sure that Massachusetts does reach that North Star that Elizabeth talked about in terms of making sure we remain the highest rate of health insurance coverage of anywhere in the country. At the Health Connector, our job is to provide access to health insurance that is easy to enroll in, as affordable as possible, and delivers the important benefits and protections that come with health coverage. Since April 1st, about 38,000 Massachusetts residents who have lost their eligibility for MassHealth coverage have enrolled in a Health Connector plan. That influx has helped us grow our overall enrollment by nearly 20% this year, and we are going to continue to do everything we possibly can to ensure that everybody who needs health insurance can get it through the Health Connector. There are a few things about the Health Connector that are important to remember, and we're going to be relentless in reminding residents about them throughout this entire process. The Health Connector's unique Connector Care program provides help that lowers and in some cases eliminates premium payments and also reduces copays and completely eliminates deductibles. And starting this open enrollment, thanks to the support from the legislature and our governor during this year's budget process, Connector Care is available to more people than ever before in the Health Connector's entire history. So income limits for people who are earning up to about $73,000 a year and about $150,000 for a family of 4. The Health Connector is a place that you can trust to provide name brand commercial health insurance plans and the benefits that people need, like free annual physicals and preventive care, comprehensive benefits and consumer protections. And for Connector Care members, that means $0 copays for medicine for chronic conditions like diabetes, asthma, and coronary disease. Please do not trust a Google search to find you low-cost coverage, which likely will not meet state standards and could leave you with big medical bills. Go to mahealthconnector.org or call 877-MA-ENROLL to get started on finding the right plan for you. We know the people who will be coming out of MassHealth will be looking for help, and we are ready to provide assistance to anyone who needs help finding new coverage in every corner of the state and in dozens of languages. Go online to mahealthconnector.org or call 877-MA-ENROLL for help. Our call center, like Elizabeth's, is fully staffed and ready to help anybody who needs assistance. Since state health reform was passed back in 2006, the Health Connector has worked to help Massachusetts lead the way on coverage nationally, and we have now more than 97% of our residents here in Massachusetts covered. This success happened because everyone across the state championed the cause of ensuring coverage for all of our residents and worked so hard to make it happen. The effort to conduct redeterminations for such a large population and to ensure that everyone lands in the coverage that's right for them will be a challenge. But Massachusetts has proved time and time again that when we work collectively, we find success, and I'm confident that will happen here again. Thank you, Mayor.
Well, good afternoon, everybody. I want to, first of all, welcome you. If you're a visitor to the City of Champions, we welcome you with open arms. This is a champion effort. We have to act now to stay connected. I want to thank all the canvassers out there that are pounding the pavements, knocking on doors, and talking to our residents. As you know, MassHealth is pivotal to our health here in the City of Brockton. 72% of our residents are on MassHealth. I want to thank Bishop Tony Branch and Marlene Amity from Haitian Community Partners. I do want to thank Councilor at Large, former Mayor Moses Rodriguez at Cape Verdean Association, and also the Brockton Workers Alliance. It's a collaborative approach right now to educate and inform. We need to act now, but I say stay covered, you have to act now. So when you get people knocking on your door, as mayor, I humbly ask you to talk, listen, and learn. When you get the mail, please open it. It's really important for your own personal health and the health of your family as well. So we are all in this together. I want to thank MassHealth. I want to thank the Health Connector, Healthcare for All. I want to thank my Chief of Staff, Sydney Merrill. But I really want to thank Representative Cassidy and all the delegation that serves the city of Brockton. The Governor, Lieutenant Governor, and the administration has been wonderful. But we are the city of Brockton, the only city in Plymouth County. So in terms of what we can do right now is we can control our own destiny for those that have MassHealth. So let's really roll up the sleeves, eye on the prize, and get the job done. And I do really want to thank all of you for being here today. I also want to thank and introduce Amy Rosenthal, the Executive Director of Healthcare for All. And again, let's continue to work together to make sure everybody is covered here in the City of Champions and in our Commonwealth of Massachusetts. Thank you very much.
Hi, everyone.
Hello.
Hello. Thank you, Mayor Sullivan. My name is Amy Rosenthal. I'm the Executive Director of Healthcare for All. I'm so pleased to be here with so many partners in the room. I want to thank Bishop Tony Branch and the Haitian Community Partners for hosting us here at the library named after Senator Kennedy. I want to thank Rep. Cassidy for being here and for all his support and the work that he's doing. I know Senator Brady is on his way. Oh, there he is. Senator Brady's here. Thank you for being here. I'm so pleased you're here. Brockton is lucky to have so many elected officials that are here. Education campaign to ensure that MassHealth members know what steps they need to take in order to stay covered. This campaign is focused in the 15 municipalities with the largest number of MassHealth members. So of the 2.4 million people currently on MassHealth, nearly 1.3 million of them live in these communities. And as we heard from Mayor Sullivan, here in Brockton, more than 72% of residents get their health coverage through MassHealth. To help people successfully navigate this process, we are running the campaign in 9 languages: English, Spanish, Portuguese, Cape Verdean Creole, Haitian Creole, Chinese, Khmer, Vietnamese, and Arabic. All of these campaign materials, including our websites, are in all 9 languages, and people can visit masshealthrenew.org for more information. As part of this effort, Healthcare for All has partnered with 38 community and faith-based organizations. These are trusted local partners who know their communities best and are working with their friends, their neighbors to educate people on the redetermination process. To date, as we heard from Elizabeth, our community partners have directly reached more than 135,000 people through over 1,000 outreach events and activities. So I want to acknowledge our terrific Brockton partners, Haitian Community Partners, Brockton Workers Alliance, and the Cape Verdean Association for their outstanding work. Please join me in thanking them. Also, thanks to the partnership with MassHealth and Molina Health, Healthcare for All is also supporting staff at 23 of these community organizations to become certified application counselors. So they can not only educate people about the redetermination process, but they can also help them with their application. We've trained 102 people to become certified application counselors, more than double what we anticipated, and both Haitian Community Partners and Cape Verdean Association are members in this effort, and so we're so thankful that they have folks on the ground doing the renewal process. In addition to the community outreach work, we have our trusted partners who are going door to door. We're doing this in all 15 of the campaign cities. Our canvassers here in Brockton are from Brockton, and you're going to hear a little bit more from them shortly. But the entire canvassing team across all 15 communities has knocked on over 375,000 doors since this effort started in April, and they've had more than 100,000 conversations with people at the doors. This is a phenomenal amount of one-on-one conversations that we wouldn't be able to do otherwise. I'm not going to steal the thunder here that I know Brian's going to share about the canvassing numbers here in Brockton, but I'll let him do that in 1 second. I think one of the most exciting things is that all this hard work is paying off. So recently, we looked at MassHealth data from May through July, and we compared what's happening in the MassHealth enrollment numbers in the 15 communities that are part of this campaign compared to all of the other communities across the Commonwealth. And what is really exciting is that the enrollment numbers in the 15 municipalities are seeing a 60% fewer changes in MassHealth enrollment compared to the communities that are not part of this. 60%. That's not luck, that is hard work, that's boots on the ground, that's making sure that people are being able to stay on the program. So clearly we can't fully take credit for all of this, and we don't know all the factors that have played into it, but I do believe the community partners, the canvassers, the work that MassHealth is doing, the work that the Health Connector is doing, all of this, insurers, providers, elected officials, all of this is paying off, and as Audrey said, we're 6 months in, we have 6 months more to go. We need to double down on our effort and keep doing this. So Healthcare for All stands ready to partner, and we are very excited. We want people to act now so they can stay covered. And now it is my distinct pleasure to introduce Brian Winston, who runs the canvassing operation here in Brockton.
My name is Brian Winston. I'm the supervisor for here in Brockton for the on-ground crew. This is my crew. These guys work real hard. We've hit at least 30,000 doors since April of this year, and we've made contact with 8,000 people. That's just my crew. You know what I'm saying? And they're hardworking folks. They're also Cape Verdean, and we have also a Haitian person, so they actually speak both the cultural languages. You know what I'm saying? I enjoy doing it. You know what I'm saying? I'm a people person, so I go back 4 or 5 years doing this before the corona, for the vaccine. But mainly right now, this is about healthcare for all, and a bunch of good guys. We did a good job.
So I have the pleasure of closing out. I want to thank everyone again. Thank you, Mayor, for having us in Brockton. Thank you, Brian, for all your hard work, you and your team. So
Great.
thank you all. I really appreciate it. Thank you, Mayor.
Thank you so much for everything.
Sorry for the last round.